Dr. Tim Hannon. I want to do a brief review of what I think is a very good article to have within your library if you're interested in laboratory utilization. And the name of it is Evidence-Based Guidelines to Eliminate Repetitive Lab Testing by Eaton and colleagues, published in JAMA Internal Medicine. So there are, I think, a couple of things of note that make this an article that you may want to have in your library if you're interested in laboratory utilization. The first is that this is published in the internal medicine literature, which may seem not notable, but if you think about it, this is an article on laboratory utilization, laboratory stewardship. Most of those show up in the pathology literature. So again, the fact that end users are more likely to look at the article because it's in internal medicine, I think is a definite plus. The second reason that I think this is a great article for your library is the fact that it's a very good comprehensive review, and if you have a good review in your library, it's like gold. There's a couple things that good reviews do for you. One is it helps you start your own understanding of a particular topic, and in this case they've done a very nice literature review for you for the pertinent articles, and have included a table that actually stretches over a couple of pages that look at 17 different articles, once again presented in a very concise manner. The second thing about good review articles is they're great for distribution. As you're trying to get other physicians up to speed on laboratory stewardship, you're not going to send them 17 or 18 articles, but you might send one or two, and this would be top of the list. The last reason, and maybe this is the most important reason that I think that this is a really good article to have in your library, is the fact that I think they've gone above and beyond what they originally intended, which is how to deal with repetitive lab testing, and have in fact defined a pathway for clinical transformation in general. Within the discussion section, they go into some detail of the organizational structure that's required at the system level in terms of leadership, composition, etc., to develop the program, but then they go through the evidence in terms of what mechanisms or what sort of categories of interventions are required to successfully drive clinical change. The first of these categories that they mention is education and communication, which again, pretty basic stuff if you've looked through the clinical transformation, or for that matter, the change management literature. For example, John Cotter, you have to provide the basis for the change. As my nurses often say to me, Tim, tell me the why before the how. So education, communication clearly has to be a component, but it's necessary but not sufficient to totally drive clinical transformation. The second major category that they list is that there have to be mechanisms for measurement and feedback. And that measurement and feedback needs to provide a baseline for information, so you can see where gaps are to engage people in the process, as well as to measure changes over time as interventions are laid in. You also need to have measurement at a number of levels, at the system level, at the department level, and for individual providers, perhaps in the form of a provider scorecard. The third major category listed to be able to effectively do clinical transformation is, of course, you have to hardwire the process, and the best way to do that is through the electronic health record. It's important to note in terms of hardwiring within the EHR that we have to go above and beyond simply either providing information or pop-ups. As we know, physicians increasingly have pop-up fatigue. We need to move up the ladder, so to speak, in terms of effectiveness towards either hard stops or what are called nudges, where we are looking to get physicians to find a default choice for the correct laboratory test or the correct frequency. So once again, hardwiring is the final step when we look at all the interventions for clinical transformation. So that's it. Hopefully there's some good information for you in this particular article and in this review. As I've mentioned, I think they've got some great pearls in terms of how to establish laboratory utilization programs, and on a larger scale, how to innovate for clinical transformation. I'm going to include information on how to find that particular article on PubMed. I'll also include my Twitter handle, and I post on a variety of topics related to high-value care, blood utilization, patient safety, and lab stewardship. And if you're an organization on your journey for high value care, would love to have the opportunity to collaborate and help you advance your practices. Thanks so much.